Welcome to the dynamic learning hub of XLR at Andheri East. A prime spot conveniently located at just a 5-minute walk from LIC Andheri Metro. In our journey of over a decade, we have proudly trained over 2 lakh students. We have also been recognized by Deloitte, Silicon India, and other accreditation bodies. Experience learning like never before in our spacious and comfortable classrooms. With high-definition projectors and state-of-the-art acoustics in place, we ensure effective learning even to the farthest point in the room. A hybrid mode is a game changer as you can enjoy the benefits of a live classroom from the comfort of your home. Even if you happen to miss any classroom session, you can still attend the same session with the same trainer at the same time at your convenience, maintaining consistency in your learning progress. Want to get started? Join us for a demo or career chat over a cup of coffee at our Andheri branch. XLR. We don't just train, we build careers.
Yes, so the collaboration with XLR was an excellent one. We conducted a Power BI workshop with Advanced Excel over a span of 3 days. The workshop was almost 12 hours long in total. Mr. Karthik, who was an amazing trainer, helped the students understand the concepts deeply. I am sure that the students will be able to apply these concepts in their careers as well as their daily lives.
The trainer, Mr. Karthik, was an excellent person where he explained in very detailed manner on how to give great insights using very complex data sets.
Yes, Chandana, shall we start or shall we wait for a few minutes? I can see 91 people joined. Good evening. Good evening, everyone.
Joined lately. We'll start that session, okay?
Yeah, so shall we start, right?
Yeah, we'll.
All right. Okay, so good evening, everyone. So let us start today's session. Okay, so what we are going to study today. Yesterday, what we have completed is the coding guidelines about hypertension, coding guidelines about diabetes, and coding guidelines about hemiplegia, right? That is paralysis of the half side of body. So what was the chapter for coding hemiplegia? Which section codes were there for hemiplegia? Anyone? Just a recap. Yes, which chapter was there for coding hemiplegia? The code was from G category, right? G category codes, G81. Okay. From where we were coding, this hypertension was coded from which category codes? Which codes were there for essential hypertension? Good evening, everyone. Which code was there for essential hypertension, primary hypertension? Yes. Yeah. No one remembering which was the code for essential hypertension? We have studied yesterday only. I002, I99 was for diseases of the cardiovascular system. Yeah. So which was the code for hypertension that we have seen? Essential hypertension. I-10 was the code for essential hypertension. Yes, right. All right. Hypertension with heart diseases. I-11. Which was the code for hypertensive crisis? Category code for hypertensive crisis. I-16. Yeah. And which was the code for type 2 diabetes? Type 2 diabetes. E11. Very good. Yes, E11 was the code for type 2 diabetes, right? So today we'll study some guidelines pertaining to the coding of neoplasm, the coding of pregnancy, that is the complications of pregnancy or any conditions which are complicating pregnancy, coding of trauma, injuries, and coding of burns, and some social determinants of health, SDOH. So this is the almost, you can see almost all the sections that we'll be covering today, right? So we'll be covering today these sections. Let us start today's session, all right? So conditions which are complicating pregnancy and childbirth, the category code that we have seen yesterday, O00 to O99. Coding guideline from neoplasm, we have the category codes C00 to D49. Coding of the trauma injuries, we have the code from S00 to T99, and social determinants of health, that is SDOH, that we'll be studying that today, that are Z00 to Z99, right? So let's start with the conditions complicating the pregnancy and childbirth. Okay, just for your awareness, first and the very important thing is these codes are only and only for the conditions which are complicating pregnancy. O category codes are not for the normal routine antenatal checkup. They are not used for normal routine antenatal checkup where there is no complication, there is no abnormality in the mother or in the baby. Everything is normal. Do not use the code from O category. All right. So we have the O category code only and only when a mother is having any complication or any condition, maybe from the beginning, or like we have seen two conditions yesterday, which are pregnancy induced, right? So if certain pregnancy induced conditions are there or pre-existing conditions which are going to complicate the pregnancy, only then you have to use O category codes, right? Like we have been talking since day 2 or day 3. We have also talked about ICD general guidelines. At that day also I told, whenever there are any situations or any conditions which are complicating pregnancy, it will be always a priority code, right? So sequencing priority is highest in O category code, all right? Now there is one more code for Z7. They are from the Z category, which you will get to know about the status of pregnancy, outcome of pregnancy. What was the outcome? What was the status? What are the weeks of gestation? But apart from that, what all conditions are there in the pregnancy? So I'll just show you the chapter that we'll be studying today, that is O category code, what all conditions are present in it, and how we are coding it, right? So we can see here there are different guidelines pertaining to that, okay? At the beginning of each ICD chapter, if you people, I don't know how many of you have seen the book. Have you been able to access the book? I hope you have been able to access the book. If not, now whenever you are going to access the book, just have one idea that whenever you are starting a chapter, just at the beginning of each chapter in ICD, at the beginning of each chapter, you will find the guidelines pertaining to that particular chapter. Okay, you can see here, these are the guidelines pertaining to that chapter. Guidelines governing sequencing and coding guidelines. All right. And after that, you will see the anatomy of that chapter, anatomy of reproductive system. Here you can see. All right. And after that, you will see all the blocks that is present in this chapter. So you can see the blocks governing these chapters. So just by looking at these, you can understand where to find the code, right? For example, any conditions like pregnancy with abortion, you will find the code O00 to O08. Then supervision of high-risk pregnancy is the code is O9. Other maternal disorders O20, preeclampsia, proteinuria, hypertension, that right. Then you will see all other complications like encounter for delivery. O80 and 82 are the code for encounter for delivery. So if you look at the block, what this chapter contains, what are the building blocks of this chapter, you will be able to understand all the details of the chapter, right? So now these are the codes where you will find all the details about the pregnancy related disorders or conditions which are complicating pregnancy, right from the pregnancy, the childbirth, the puerperium. Now, what are these terms called as? What do you mean by antenatal period? Is anyone aware of this? What do you mean by antenatal period or antepartum? What do you mean by antepartum? Yes, anyone? The period of pregnancy before the childbirth. Yes, before the childbirth is antepartum. Very good, right? Now, what is postpartum? Postpartum is a period of 6 weeks immediately after the birth of the baby, up to 6 weeks. All right, up to 6 weeks. Yes, after the delivery, up to 6 weeks. That is postpartum, right? And puerperium is the period after the delivery till the uterus becomes to normal size. Okay, so it is usually on an average 45 days. On an average, it is 45 days. So when you are reading the charts of these patients, you will find that these charts have, these codes have all these kind of conditions. Now, when you see first codes are about the abortion, where abortion is the outcome of the pregnancy. It can be either medical abortion, that is medically terminated pregnancies, elective abortion, or it can be the threatened abortion. Now, in these codes from O10, where actually the conditions complicating pregnancy starts, we can see here all these codes are arranged as per the trimester. As per the trimester. Now, how the trimesters are calculated? The trimesters are calculated based on the weeks of gestation. All right? They're calculated on the basis of weeks of gestation. 1 week to 12 weeks of gestation is called first trimester. Second trimester is from, and you can find it right here, okay? You will be able to find it right at the beginning of every code. It is defined what is the trimester. All right, you can see here. The definition of trimester you will find at the very beginning, right? Weeks of gestation. All right. Just give me a minute. Okay, first to 12 weeks is first trimester. 13 weeks to 24 is second trimester. And 25 weeks to next till the delivery of the baby is third trimester. All right. These are the different trimesters, and all these codes are arranged as per trimesters. You can see here diabetes in first trimester, second trimester, diabetes complicating the childbirth, and diabetes complicating the puerperia. So according to that, the codes are arranged. Now, there are when you are coding for the pregnancy and complications of the pregnancy, first thing that you have to understand is, first you have to write about the details of the code will be first from this category, that is the condition itself, that is from O category. After that, you'll have to give the code for weeks of gestation. And the code for weeks of gestations are given in Z category. The weeks of gestation are given in Z category code Z3A. All right, you can see here. So on the maternal record, that is the record of a mother, you will have multiple code. First code will be about the condition that is complicating the pregnancy. If there are any other codes, you are directed to code also or use additional code for that particular condition, that also you'll have to code. And along with that, you will have to use the code for weeks of gestation. All right, so you can see here the codes for weeks of gestation. Now, first code that we have is unspecified or less than 10 weeks, but do not take the code unspecified very often. Though ICD has given us the liberty, do not use it. What shall you do instead? If the documentation is missing, what we will be doing instead of writing unspecified? The first step will be, what will be the first step if the documentation is not there? What will you do? Whatever comes to your mind, use that code or analyze and think and give the diagnosis and write the code. Query the physician. Very good. Excellent. Yes. Before putting the code or assigning the code of unspecified, always query the physician. Okay. Unspecified is the last resort. When you do not have anything or any data, it is impossible to get the data. That time you use unspecified. But otherwise, do not use it. First, query the physician, right? And you can see that weeks of gestation up to 8 weeks, that is less than 8 weeks, it is Z3A.01. And after that, you can see all these characters. Just have a look. They correspond to the weeks of gestation. For 9 weeks, Z3A.09. For 11 weeks, Z3A.11. So just you have to remember this. So somebody was asking me how to remember the codes, right? So there are some certain tricks. If you keep reading the book, you will understand. Usually when 9 is the end of the code, usually it is unspecified. In certain cases, 0 is unspecified, right? So you will just remember the tricks of remembering code, right? So you can easily remember this code. You just need to understand Z3A, and at the end you have to put the weeks of gestation, right? So up to 42 weeks of gestation is given. And after that, there is a code for greater than 42 weeks of gestation. Greater than 42 weeks of gestation. Ideally, the weeks of gestations are up to 40 weeks, but sometimes it is delayed delivery. So you can have the 41, 42 weeks, right? So that is the code for weeks of gestation. Now there is one very important guideline when you are coding about the weeks of gestation. The weeks of gestation, when you are coding, you will have to code only the completed weeks of gestation. Code only completed weeks of gestation. What does this mean? What does this mean? If a physician has written 39 weeks, 6 days, don't take it as one day, okay, just one day. Okay, just one day. And I can take 40 weeks. Don't do that. All right. Okay, one day, and I can add that one day from my side. It's just one day. Let us make 40 weeks. Don't do. You have to code completed weeks. So 39 weeks code. So what will be the code here for 39 weeks? Z3A.39. All right, Z3A.39. Suppose if it is written pregnancy or weeks of gestation, 12 weeks, 5 days. What will be the code now? Z3A.12, right? Okay, don't take the next week. Take only the completed weeks of gestation. Okay, that is very important when you are coding about the weeks of gestation. And there are certain codes for outcome of delivery. Outcome of delivery that is to be taken on maternal record. Now, what is the outcome of delivery? What is the outcome of delivery that you have to take? We'll see what is outcome of delivery, right? Give me a minute. So you can see here outcome of delivery. Just see the expansion codes: single live birth, single stillbirth, twin babies, both live. What was the outcome of the delivery? 2 babies, 1 baby, triplet, multiple babies, all babies are alive. Is there any dead baby? So all this outcome of the delivery is given. So now when you're coding for the complications of pregnancy, what all things you need to keep in mind? Can anyone just revise that? What you have to, what codes you have to do? Remember, O category code that will take priority over all other code. All right, code. After that, you'll have to code for the outcome of the delivery, which is the code from Z37, and you always have to give the weeks of gestation. See, we will talk about the book at the end. Please, right now, don't message about the book, the LMS. Just see and focus on what I am teaching, please. Right? We will talk about why LMS is not working, why ICD book is not opening. We will talk at the end. I'll give you 5 minutes to ask about the questions related to book and everything. So it's a sincere request to all the students to first focus right now on what has been taught and what are the guidelines. Right? Please. Okay. So how the sequencing is done is first you give the condition for which the pregnancy is getting complicated. After that, code for the weeks of gestation. All right, and after that, if a woman is coming for the delivery, you have to give the code for outcome of the delivery, right? There are certain codes for outcome that right now I have seen. Okay, I have shown you. Now there are certain codes related to the normal delivery. We can see here when the patient has come for the delivery, encounter for delivery. So what are those codes? Keep those codes in mind when the patient comes for, when the woman comes for the encounter for delivery. That is for normal delivery. When she comes for the normal delivery, we have the code OAT. OAT is the code for a woman who has come for normal delivery. All right. Encounter for delivery. Encounter for full term uncomplicated delivery, OAT is the code. Along with that, you'll have to give the outcome of delivery. Okay, and if there is, now just read this code which says encounter for cesarean delivery without indication. What do you mean by this? What do you understand by this? Without indication. What do you understand by this term? Without indication. Yes. Without pain, yeah. Without indication means what? When there is no medical necessity. When there is no immediate threat to the baby's life or to the mother's life, and it is almost, you can say, elective. If a woman or if the pregnant woman wants to go electively for the cesarean surgery, so if a patient chart reads that it is elective cesarean surgery, that time you have to take code O82. All right. O82 is for elective cesarean section, and O80 is for the encounter for full term uncomplicated surgery, is uncomplicated full term delivery. All right. So these are the codes for O category code, and they take priority for every other code. The first code always will be O category if a woman is pregnant and if she has any other conditions. So now we'll start a very important topic about coding of the neoplasm. What do you mean by neoplasm? What do you mean by neoplasm? Cancer, cancer, cancer. What do you mean by neoplasm? Carcinoma, cancer. Okay. Yes, it's written in the slide itself. It's written on the slide. Excessive abnormal growth. Abnormal growth of the tissues or uncontrolled cell division, or when the cells refuse to die their natural death. Every cell has its lifespan. We have discussed, right? We have discussed about the lifespan of RBCs. How much is the lifespan of RBCs? How much is the lifespan of RBCs that we have discussed? Yes, 120 days. Very nice. Correct. The lifespan of RBCs is 120 days. And after 120 days, what happens? What happens to RBCs after 120 days? Destroyed in spleen, right? When these cells, which should die their natural death, they do not die their natural death and they keep dividing, that is also called as cancer. So cancer or neoplasm, not cancer. So neoplasm is either abnormal growth of a tissue or when the cells do not die their natural death. That is neoplasm. Now what you are talking about, cancer, 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 neoplasm is further divided into two types. One is benign, which is non-cancerous, and one is malignant, that is cancerous. Now what is the difference between benign and malignant is, benign is stays in that particular tissue. It does not invade other organs. It does not spread to any other organ. Right? Yes, that is benign cancer and benign neoplasm. And when we say term cancer, it is always malignant. When we use term cancer, it is malignant and it spreads to different tissues. It can spread to any tissue in the body, and that spreading of that cancer is called metastasis. What it is called as? Metastasis. Right? So spreading of that cancer, the cancerous tissues which are getting metastasis, they are always malignant and cancerous. They are not benign. And benign, they never invade any other tissue. All right. But benign neoplasm can eventually become cancerous. All right. Can eventually become, sometimes can become cancerous. So these are some of the types. Now, before understanding the guidelines, we'll just understand the terms which are used, the terminology which is used in cancer. The primary malignancy means the original site from where the cancer is originated. That is primary malignancy. And secondary malignancy means the metastasis of this cancer. For example, a person has lung cancer and lung cancer metastasized to pancreas. So primary cancer is, which cancer will be primary? Primary cancer will be, where is primary malignancy? Lungs. And secondary malignancy will be in pancreas. Very good. Secondary malignancy will be in pancreas and primary malignancy will be in lungs. All right. Now, benign that we have seen, it has not spread. There is one more term that is in situ. In situ means it is very much at the site where it has originated. You can say almost on the cellular level. Almost at the cellular level. That is early stage of cancer. That is called as CA in situ. That is called as CA in situ. In situ means in the site itself, right? Now, these two terms are very important here: uncertain behavior and unspecified. A malignancy of uncertain behavior, which means the nature cannot be clinically found out, whether it is benign or whether it is malignant. Some cells showing malignancy and some cells showing benign. So that is uncertain behavior. And when we say unspecified, it means it is not possible because there is insufficient documentation. Unspecified is we do not have the documentation to understand whether it is malignant or whether it is benign. But uncertain behavior means physician himself or the provider himself or herself is not able to understand because of the nature of the neoplasm, that whether it is benign neoplasm or malignant neoplasm. So there will be uncertain behavior. So we have seen the alphabetic index. One of the part of alphabetic index is where you can find neoplasm. What is that? Which part of alphabetical index you can find the codes given for neoplasm? Alphabetic index has 4 different parts, right? ICD, out of ICD alphabetic index, which part? Correct. Very good, Karthik. Table of neoplasm. In table of neoplasm, you will be able to find all these terms: primary malignancy, secondary malignancy, benign, in situ, uncertain and unspecified behavior. The table of neoplasm is arranged, all parts of table of neoplasm. The table of neoplasm is arranged in that way where you can find that you will see the table of neoplasm. All right. So for example, if I have to see the neoplasm of pancreas, which is primary neoplasm. Okay, if I have to see the primary malignancy, okay, not neoplasm. Neoplasm is a broad term. Now, if I have to see the malignancy, okay, if I have to see the malignancy of primary malignancy, that is, malignancy is originated in the pancreas. So I have to see the primary malignancy of pancreas. So all right. So how can you see here? See the table of neoplasm, how it is arranged. All these things are arranged in the, all right. All these, the first is a neoplasm. This column is arranged in alphabetical manner. Okay. So it starts with abdomen, right? It is arranged in alphabetical manner. Then on these 6 columns, you have to identify whether this is primary malignancy, whether it is secondary malignancy, what is CA in situ, whether it is benign, uncertain behavior, unspecified behavior. So now I have to see the code for pancreatic cancer, the duct of pancreas, okay, the cancer of duct of pancreas. So now I have to see the pancreas, right? This is C, E, okay, H, I, M, N. Now here, code will be of, right? You can see here pancreas. Under that, there is duct of pancreas, and you can see the code which I have said, it is the primary malignancy. So the code for primary malignancy, the first column is primary malignancy. So the code for primary malignancy of duct of pancreas is, what is the code here? C25.3. Correct? C25.3 is the code for the pancreatic duct cancer. So these I have to just cross verify. I cannot just assign the code based on the alphabetic index. I have to go to that chapter, that is malignant neoplasm, and identify whether this is right or not, whether there is any exclude note, any include note that I have to take care, any code first. All that guidelines I will find only in tabular list, right? So now see the malignant neoplasm of pancreatic duct. This is the code C25.3. All right. So this is how I'm going to assign the code by looking at table of neoplasm. All right. Now, if I have a patient who has malignancy, which is secondary malignancy of upper quadrant of breast, secondary malignancy of breast. Now I have to go, I don't know the primary malignancy, all right, yet I don't know the primary malignancy, I only know that the secondary malignancy is there and that is of breast. If I go here, a bone, brain, breast. Now under breast you can see the secondary malignancy of breast, and in that you have got all these upper quadrant, lower inner quadrant, and I said upper outer quadrant, and now here it is secondary malignancy. So can you tell me the code of that? The code for secondary malignancy? C79.81. Correct. So that is a code for secondary malignancy of upper outer quadrant of breast, right? So this is how you have to understand how to find alphabetic index, in that how to find the code, locate the code, go to the tabular index and read the description of the code. Okay, do not assign code just looking at that. You have to go to that code. What we have seen right now, C79.81 is the code that we have to assign. So just read all the description of C79. C79.81, right? Secondary malignant neoplasm of the breast. So now in the alphabetic index or in the neoplasm, table of neoplasm, we have seen it was specified the site, upper quadrant, but our tabular list does not give the location. So what to do now? You have to still take this code. That's the reason you have to always cross-reference, take the cross-reference of tabular list and alphabetic index. Both you have to use and you have to see. Now, if you just go to the tabular list, you may not be able to find the code at all. You may not be able to see it because there is no code for upper quadrant, right upper quadrant or upper outer quadrant. Nothing is given about it, right? That's the reason you have to refer to alphabetic index as well. All right, so now I hope you understood how to assign the code from table of neoplasm. Right? How to locate the code, everyone? Did you understand this? All right. Okay. Now, there are certain codes for the encounters for malignancy, right? Encounter for malignancy, that is encounter for the treatment of malignancy. How many types of treatments are there for malignancy? What kind of treatment, what line of treatment is there for cancer? Chemotherapy, radiotherapy, anything else? Surgery, yes, very good. Surgical removal, yes. Radiotherapy, chemotherapy, surgical removal of that organ. Immunotherapy, some immune chemicals are given, immunotherapy. These are the therapies or the treatment for cancer. Now, if the patient has come for the treatment of cancer, we have the code for encounters that is coming from the Z category code. Now just see Z51.0 is the encounter for radiation therapy. Okay. Diagnostic procedure. What kind of diagnostic procedure? Diagnostic procedure codes are not here. Biopsy codes are given in that particular chapter. Okay. Biopsy codes are given in CPT. Right now we are talking about diagnosis, not diagnostic procedure. We will be talking about the procedures when we talk about CPT. Okay. So Z51.0 is for the encounter for radiation therapy. Z51.11 is for chemotherapy and 12 is for immunotherapy. So these are the therapies of cancer, and according to the encounter, the nature of encounter, we have this code Z51. Z51 is the code for anti-neoplastic therapy. And under that, these are the expansion code. 51.0 for radiation therapy, for 11 is for chemotherapy, and 12 is for immunotherapy. All right. And there are certain Z codes, that is Z85. Under Z85, you will find the personal history of malignancy. And 48.3 is the aftercare for following the surgery. For example, if the pancreatic cancer is there and pancreas are removed, and after that the patient is coming for the aftercare of this surgery, that is Z48.3 for the follow-up or aftercare of surgery. And now if person, this history is that you have removed the cancer, now there is no more treatment directed to that, then it is a history. We will discuss that. What is current neoplasm? What is history of neoplasm? Right now, just remember these are the code for encounter for chemotherapy, radiation therapy, and immunotherapy. Right? So now when you are coding for the neoplasms or the cancers, you have seen how to assign the code. You have also seen what is primary malignancy, what is secondary malignancy, what is CNC2, all that. Now there are certain guidelines which you have to understand. Okay, sequencing rule. The most important guideline for or rule, sequencing rule for ICD is for what the patient has come, that should be your first diagnosis. That should be your first diagnosis, that where your treatment is focused. All right, where the treatment is focused should be always your first diagnosis. So on the left side of this table, you will see the reason for treatment, and on the right side, you will see the sequencing. Now in all these, there are the one common thing is for what the patient has come, that will be the first diagnosis. For example, as I said, if the patient has lung cancer, which is the primary site of origin, which is metastasized to, say, pancreas, or say cancer, stomach, okay, lung cancer metastasized to stomach. Now the patient has come for the treatment of the radiotherapy for the lung cancer. Radiotherapy for the lung cancer. So what will be our primary code? Which will be our primary code? Lung cancer or stomach cancer? First will be the code for lung cancer, followed by the code for stomach cancer. You have to give both, right? Secondary diagnosis or comorbidities you have to give, but it is just the sequencing that you have to change. Now, if the same patient has come for the chemotherapy of the stomach cancer, same patient, primary site is lung, secondary site is stomach. Okay. Now the patient is coming for the chemotherapy of the second, that is stomach. What will be our first code? Chemotherapy followed by, for what the chemotherapy you are giving for what? You are not giving for lung. Chemotherapy you are giving for stomach, right? So the code will be stomach, the cancer of stomach. Then the cancer of lungs, right? All right, this is clear? This is clear? Yes? Now, as we have already studied pregnant patient with malignancy, take the code from O category. O9A.1 is for the malignancies. Malignancy is complicating pregnancy. Okay, take the code from that category and then give all primary, secondary malignancy sequencing, right? Now, two different things are there. It is a bit complicated, but just try to understand the situation. If the complication is associated with the neoplasm, not with the treatment of neoplasm, okay, the complication is associated with neoplasm, like pain due to neoplasm. Pain due to neoplasm. If patient is coming for treatment of the pain, if the patient is coming for the treatment of the pain, code first pain. Code the complication first. Code the complication first and then code neoplasm. Say for example, if there is neuroma, all right, the complication will be pain. Pain due to neuroma, neuromyoma. I will talk about that, Karthik. We will talk about that. Right now, we are talking about the complication associated with neoplasm. So just focus on that. Complication which is because of neoplasm. पैंक्रियाटिक कैंसर है और डायबिटीज है उसकी वजह से. ओके, पैंक्रियाटिक कैंसर की वजह से डायबिटीज है. विच विल बी द कोड वी हैव सीन यस्टरडे. अंडरलाइंग डिसऑर्डर E13, राइट, E13 पैंक्रियाटिक कैंसर है, उसकी वजह से कॉम्प्लिकेशन है डायबिटीज. पेशेंट इज कमिंग फॉर द ट्रीटमेंट ऑफ डायबिटीज. Code first that complication and after that code for the neoplasm. First code G89 जो pain के लिए, which is the code for pain, right? G89 is the code for pain. G89.3, that is code that first, that is pain due to neoplasm, followed by the neoplasm. All right, there is exception to this code that one has to remember. Exception is anemia. If anemia is because of neoplasm, you have to first code anemia. First code anemia. We have the special code for that, anemia due to neoplasm. D63 is the code for that. You have to code first anemia followed by the code of neoplasm. Sorry, first code neoplasm followed by the code of anemia. Apart from anemia, all other will be, first will be the complication followed by neoplasm. And if anemia is there, first will be neoplasm followed by anemia. Is the only exception. Is the only exception, right? Complication first followed by neoplasm. Now, if the complication is because of the treatment that we have talked about, if complication is because of chemotherapy, complication is because of radiation, radiation proctitis. Because of radiation, there is a development of the inflammation of proctor, that is inflammation of colon. So radiation proctitis, that is a complication of the treatment. And for that, the patient is coming. We are treating the complication of therapy. All right, we are treating the complication of therapy. So first write the complication for what the patient has come. After that, the code of neoplasm. After that, the code of neoplasm. All right. If the patient has come for the fracture due to neoplasm, which is a pathological fracture. So in that case, if you are treating a fracture, code fracture first. If you are treating the neoplasm, code neoplasm. See, everywhere just you have a look at the reason and sequencing. One thing is common in all of these is for what patient has come, that will be your first listed diagnosis. Only exception is anemia. Only exception is anemia. If anemia is because of neoplasm and you are treating anemia, in that you have to code first neoplasm and then anemia. And if anemia is due to therapy or complication of the treatment, code first anemia followed by neoplasm. This is the only exception. In rest of all the cases, you have to code the condition for which the patient has been coming. That's it. So just remember, this is a golden rule. For what condition patient has come, code that condition first. All right. There are a few exceptions like anemia. Is it clear? Pregnancy will take, always pregnancy code will be the first code. All right. If Prathamesh has asked very good question actually. If anyone has pain due to neoplasm and she is pregnant, so malignancy code will be first. The this O category code, that is O9A, that code will be first always. O category code takes over the priority of every other code. So very nice question, Prathamesh. He has asked the question that if anyone has a pain due to neoplasm and that woman is pregnant and she has come for the treatment of the pain. So 091 is the priority code that you will have to take, followed by the code of pain and followed by the neoplasm, actual neoplasm. All right. I hope Prathamesh this is clear to you. Clear? All right. Okay, now let us see what does it mean by current malignancy and when to say as the personal history of malignancy, when to say it as a history and when to code as current malignancy. Because we have a complete chapter or complete code range in Z85. In Z85, there is a code range given for in Z85, there is a code range given for personal history of malignant neoplasm. So when to call it as a history, when to say that this is the history and when to say this is the current malignancy. So just remember this because this is sometimes this is a tricky question and most of the time is the favorite question of interviewer. Most of the time it is the favorite question of interviewer that if a person with the pancreatic cancer has come and the pancreas has been removed 6 weeks back. Pancreas has been removed 6 weeks back and now the patient has come for the chemotherapy directed to pancreas. What will be the code? So just remember, as long as we are giving the treatment to that particular cancer, it is not a history. It is still the current malignancy. It is still the current malignancy, right? So you have to take it as the code from C category. That is the code range from C00 and not the history code. When there is absolutely no treatment directed to that site, when primary malignancy has been previously excised, eradicated, and there is no furthermore treatment, no radiation, no chemotherapy, no anti-neoplastic therapy, no immunotherapy, nothing is given for that site, then it is called as the history of that malignancy. One more situation is there. Say, for example, just in the first case, which I gave you the example, there is a lung cancer and lung cancer metastasized to pancreas. Lung cancer metastasized to pancreas. Now, lung cancer, there was a lobe which was affected. That lobe has been removed. That is lobectomy of that lung. That lobe has been removed. Okay, there is no treatment given to the lung now. Lobe has been removed. The chemotherapy sessions are over. No further treatment directed. But the patient is coming for the pancreatic cancer treatment, the treatment of the secondary malignancy. All right, the patient is coming for the treatment of secondary malignancy. So now you still have to take the code from history of malignancy because now you are not treating the lung cancer. So it is the history. Though secondary malignancy you are treating, but the primary malignancy is the history now. There is no more treatment required for that. Did you get the point? Everyone understood? Right? So just remember, as long as the treatment is going on, it is a current malignancy and do not assign the code from Z85 and take the code rather from the current malignancy, that is C00 or D category. All right. So this is current malignancy versus personal history of malignancy. So now these are the coding guidelines that we have discussed. Only thing you have to remember, there is only the exception for anemia. Rest all sequencing you have to remember for what the patient has come, code that first. except anemia. Anemia is if it is because of neoplasm, code neoplasm first and then anemia. If anemia is because of the treatment, code anemia first, then neoplasm. All right. Yes, this is clear. Is this clear, the sequencing of the, right, everyone? All right. So let us see just one or two questions. All right. Chip is an unfortunate 35-year-old who has been diagnosed with lung cancer. Right. He has been receiving chemotherapy and radiation. He developed seizures and is admitted. Workup revealed that metastasis of the lung cancer to the brain. Now, instead of going to the diagnosis code, you first tell me which is the primary malignancy and which is the secondary malignancy in this case. Now, this second question is different. Don't give me A, B, C, D. You tell me which is primary malignancy and which is secondary malignancy. Lung cancer is the primary malignancy. Yes. Okay. And which is the secondary malignancy? Brain is the secondary malignancy. Yes. Okay. Metastasis of the brain. That is the secondary malignancy. Now, if you want to see the code for this, we have to see what is there. Lung cancer and secondary malignancy is brain. So now just let us see the code for that. Lung cancer and lung cancer code we have seen, right? If I remember, or we've seen the pancreas. Lung cancer. Here we see lung cancer. We do not have any detail about it. So you'll have to take the code C47.5. Okay, we do not have any detail of this. C47.5 is the code for the primary lung cancer. Now, if you have to see the code for brain, okay, brain, we'll go to those codes, okay, don't worry. Brain. Now, here nothing is given about the brain, which cancer it is. We'll go to this code, which code you will take in this? Tell me which code you are going to take. C71.9. C71.9. So which code you will take? Brain cancer is a secondary malignancy here. So secondary malignancy code will be there. C79.31, right? Okay, C79.31. And first we have seen C45.3. That is for the lung cancer. All right. So let us see the code for this. C45, which is our primary cancer, that is lung cancer. C47, sorry. C47. No, which was the lung cancer? C43. C34, neoplasm, malignant neoplasm of the bronchus, but we do not have the exact location of the lung, primary location. So we'll have to take unspecified part of this code we have to take. Malignant neoplasm of unspecified part of the lung. C34.9. So that's the reason you have to come here. Nothing is known whether left or right. So you have to take C34.90, which is for the unspecified part of the unspecified bronchus or lung. That is the code that we will take for the primary malignancy. For secondary malignancy, that was C79 point. All the secondary malignancy codes are given after C79. Okay. Secondary neoplasms, they start from C77. C79, brain, malignancy of the brain, C79-3. Yeah. Here you'll have to take unspecified. I'll come to that code. Secondary neoplasm of brain, C79.31. So this is how you have to locate the code. All right. Now just looking at this code, you just read the question and understand. A patient with diffuse large B-cell lymphoma throughout the lymph nodes is admitted for chemotherapy. Just you tell me first, code for chemotherapy. Tell me in this question, which is the code for chemotherapy? Encounter for chemotherapy. Encounter for chemotherapy. Z50 1.11. Encounter for chemotherapy. Right? Z50 1.11. Encounter for chemotherapy. So first code will be Z50 1.11. So what will be the answer? Just looking at the sequencing, you can understand what is the answer over here. What is the answer? 1. Answer is 1, right? So if you know the sequencing, you can directly find out what could be the answer for this question. All right. So the concept of primary malignancy, secondary malignancy, how to find the code, how to locate the code, how to sequence the code. Is it clear? All right. Okay. So let us start the next coding sequence that we have to understand is about the coding of trauma, injuries, and burns. Very important. This is very important coding. The chapter is chapter 19, is the biggest chapter of this ICD. The code ranges from S00 to T99. Code ranges are from S00 to T99. From S00 to S99 are the injuries specific to particular regions, and T00 to T88 is for the multiple injuries, burns, and corrosions. All that is given in the T00 to T88. Right. So whenever you are coding for trauma, injuries, burns, there are the code from external causes that you have to add. You'll have to add the code for external causes. I'll come to that point. Let us see what all is given. First, let us see about the fracture. The coding of the fracture. Now, there are two different types of fracture, pathological fracture and traumatic fracture. What do you mean by pathological fracture? What do you mean by traumatic fracture? What do you mean by pathological fracture? What do you mean by traumatic fracture? Yes, anyone? It's easy. I have put it on the slide. What is pathological fracture? It's there on the slide. Due to certain underlying pathological disorder, the bones become weak, and then that results into the multiple fracture. So I'll give you an example of a pathological fracture. How you to call it as a pathological fracture. So say for example, if you are walking, a normal person who is walking, and you just rub your shoulder against the wall. Just by mistake, you rub your shoulder against the wall. Are you expected to get the fracture? Right? But if that happens to a person that he just rubs the shoulder against the wall and get fracture, we call it as a pathological fracture. It is because of the brittleness of the bones. And the bones might have become brittle because of certain underlying disorders. So what underlying disorders can be there? There can be some cancer like bone cancers, There can be a situation called osteomalacia, which is due to deficiency of vitamin D, osteoporosis, right? Then hyperparathyroidism. Now, what is osteoporosis? Osteo means bone, porosis means they become porous, less bone density. Yes, they become porous, right? That is osteo, that is bone, porous, porosis. It is porous, it is brittle. There are many conditions which causes osteoporosis. Many conditions which cause osteoporosis. Out of them, few are menopause. Few are menopause, diabetes, vitamin deficiencies, mineral deficiencies, hyperparathyroidism. All these are the conditions which results into osteoporosis. And the people or the patients with osteoporosis have the tendency to get fracture multiple times. Multiple times. So if a person who is having this underlying problem and that is giving that person fracture again and again, that is called as pathological fracture, and in that condition do not take the code from S category. Do not take the code from S category. We have the code in musculoskeletal system, that is M84 is a category code. Under that, different situations are given where the pathological fracture is there. So if a person is having this pathological fracture, take the code from musculoskeletal system, not from S category, that is injuries and fractures and trauma. All right, don't take that code. Okay, so M84 is for the pathological fracture. Traumatic fracture, which is of course as a result of injury, and there are different codes, S02, S03, S04, all the different types of codes are there for the pathological fracture. Now, when you are coding for the pathological fracture or coding for injuries, in the seventh character is very important. What does the seventh character specify? What does the seventh character specify? The seventh character specifies the nature of encounter or the reason for visit, why the patient has come. Whether it is the initial encounter, whether the patient has come for the follow-up, whether the patient has come for the non-union, mal-union, multiple things are there. So why patient has walked down to the chamber, that you have to code using 7 character. So if it is because of the fracture is because of the trauma, the codes will be from S category, traumatic fracture. Do not take the code from musculoskeletal system. Now, when you're coding for the fracture, what is important is to understand the types of fracture. Okay, to understand the types of fracture. The code 7 character is given based on the type of fracture. A character is used for closed fracture. 7th character A is used for closed fracture and 7th character B is used for open fracture. Now you see what is open fracture, what is closed fracture. The name itself suggests open means what? It has come out of the skin. You can actually see this bone coming out of your body. That is open fracture. And closed fracture, this is within the body. You cannot see unless you do any X-ray or any other investigation. So that is closed fracture. So if you do not have any documentation regarding open or closed, whether this is open fracture or whether this is closed fracture, by default, you have to take it as a closed fracture. By default, you have to take it as closed fracture. And if it is not indicated whether it is displaced or non-displaced, by default, you have to take displaced fracture. Displaced means what? The bone is pulled out of the normal alignment. This is the alignment of the bone. And out of that, the bone, you can see there is a gap, non-alignment. And if there is alignment, that is called non-displaced fracture. So if the type is not given, take it by default closed. Whether displaced, not displaced, not given, take it as displaced. Okay, because that is what is common. Like we have seen yesterday in hemiplegia, nothing is mentioned, take right side dominant. That is common. Similarly, closed fracture is common. You don't see open fracture very often, right? That's the reason you have to take closed fractures by default if nothing is mentioned. If nothing is mentioned with a displaced, not displaced, take it as a displaced fracture because that is what is common, right? So this is the fracture. We'll see about the different uh, characters, 7 characters that we use in fractures. All right. The category code is from S. Right. And everywhere you will find under each code, each category code, which 7th character can be used is given. Which 7th character is used, it is already given here. Right, you can see here ADS. Under fractures, you will see ADSK. All right. Here again, you can see ADS. Yeah. Now you see the fracture of shoulder of upper arm. Under that, see how many 7 characters are used here. You can see the 7th characters, the number of 7 characters. A is for initial encounter for the closed fracture. B is for the initial encounter of the open fracture. D is for subsequent encounter just for the routine healing. That is, patient is coming for the routine healing, routine checkup. Subsequent encounter where there is delayed healing. The fracture was expected to heal in 6 weeks, but it is not healing, that is delayed healing. K is for the non-union. There is no union between the fracture bones. Then there is union but malunion, that is P. And S is for the sequelae. Sequela means there is any residual effect. Right? Any bone will be affected by pathological fracture. Pathological fracture can be caused to any bone. Okay, somebody asked me the question whether the pathological fracture only affect thin bone or thick bone. There is nothing like that. It affects any bone. All right. So you can see here different codes are there. So now what do you mean by initial encounter and what do you mean by subsequent encounter? This is very important. Like we have seen in malignancy, current malignancy and history of malignancy. So as long as the treatment of the fracture is going on, for example, plaster is still there. Patient is coming to just check up. 6 weeks plaster is there. One patient came after 1 week. Patient came after 2 weeks. You still call it as the initial encounter as long as you are giving the treatment for that particular fracture. That is initial encounter. Now plaster removed, patient is coming for the checkup, just for physiotherapy, for checkup, for gaining the movements back. So that is routine healing. Take the code for subsequent encounter. That is 7th character D. Now plaster is removed, everything is done, but it should have been 6 weeks. By that time, patient might have been better, but it's not there. Healing is not proper, it's not happening. Take the code G, that is 7th character as G, right? So you have to assign the 7th character based on what type of visit patient has come for, right? So that is initial encounter and subsequent encounter, all right? There are many everywhere that will be given, all right? You can see here again, initial encounter, subsequent encounter, right? Depending upon the types of fracture. ADS, all right? S is a sequela. Sequela means the residual effects. For example, plaster is removed, fracture is fine, everything is union is there, but there is constant pain. There is constant pain in that area. That is the sequelae. Okay, sequelae of that particular disorder. Sequelae means the residual effect of the disease. So disease has been treated. For example, in corona, everyone was fine, but after corona, someone lost their sense of smell, sense of taste. That was the sequel of corona, COVID. Sequela means residual effect. Okay. So 7th character code you have 7th character you have to assign proper 7th character for fractures. So main thing when you are coding for the fracture, you have to remember one thing If nothing is mentioned about the type, take it as a closed fracture by default. If it is displaced or non-displaced, you don't know, take it as a displaced fracture. Take it as a displaced fracture. So these are the coding guidelines for fractures. Anyone has any doubt? If not, we'll start with the types of injuries and coding of the injuries. So these are the types of injuries. Superficial injury, abrasion, contusion. These are called as a superficial injuries. Abrasion, like just you had a scratch, that is abrasion. Contusion, have you seen contusion? Sometimes you just get green and blue and green. You had fall and just have green and yellow, blue there. That is contusion. Okay, that is contusion. Then laceration, you can see this is the diagram for laceration. All right. Avulsion, where the skin or the flap of skin is removed from that portion, that is avulsion. And punctured wound like for the needles or gun, okay, gunshot wound or some needles, something is punctured deep inside the skin. These are the types of wounds. And on the basis of types of wounds, the codes are arranged in S category: anatomical site and the type of wound. So the codes are arranged as per the type of wound and as per the anatomical site of the. So you can see here. See. All right. It starts with the S00 is the code for the wound in scalp, neck, head. It starts with the injury to scalp. All right. Injury to scalp. And different types of injuries are given here. Okay. Yes. S01 is the open wound of head. Right. From here, the wounding starts. Superficial injury. First is for the unspecified. Then the wound. You can see different types of wound. Laceration, puncture wound with foreign body, without foreign body, laceration without foreign body. What do you mean by foreign body? Laceration without foreign body. Suppose there was an accident, car accident, or there was accident, road accident, and there is laceration. Sometimes the stones, small stones, or the pieces of glass, they are present inside the wound. So that is foreign body. So laceration with foreign body, without foreign body. Okay, so this is arranged anatomically. You can see ear, laceration of ear, superficial injuries, then fracture, all right, fracture of skull, fracture of condylar processes, all right. Then you can see the injuries of sprain and joints and ligaments. So this is all arranged as per the different sides of body, anatomical sides of the body: penetrating wound, punctured wound, avulsion. All right. So these are different types and site. Now, when you are coding this up for the injuries, there are certain guidelines which you have to remember when you are coding for injuries. The most important thing is if there are multiple injuries, if you are coding the multiple injuries, most severe has to be sequenced first. Most severe has to be sequenced first. Where the treatment is focused more, which is giving the risk to the life of the patient, that needs to be sequenced first. So, for example, if a patient has brain injury and just a broken arm, of course, brain injury has to be sequenced first. Right? Brain injury has to be sequenced first, followed by the broken arm. It is not that you don't need to code the broken arm. You have to code for the broken arm. You have to code for the fracture. But head injury or brain injury has to be sequenced first. Right? If there are any combination code for the multiple injuries, take the combination code. Okay, combination code will be there. Take the combination code. We have seen what does the combination code mean. What do you mean by combination codes? What do you mean by combination code? Yes? We have discussed combination code yesterday. So many combination code we have discussed. What do you mean by combination codes? What happened? Don't remember? Code for, yes, one code for many conditions, right? One code for multiple conditions, right? Multiple conditions can be coded using one code, that is combination code. So if you have combination code, take combination code, right? And on every injury code, whenever there is injury, you have to take the code from external cause chapter. The external cause of injury where all the different types of scenarios. So why to take the external cause of injury is, what is the purpose of coding is you have to tell the story, right? You have to tell the story. We have seen that in the very beginning, that you have to tell the perfect story. What happened? How it happened? So for example, if a patient comes for the fracture in accident, fracture due to the motor accident. So you have to take the code from external cause code. Where was the accident? Which was the place was accident of accident? Whether it was the traffic road, non-traffic road. Whether the person was riding the bicycle or he was driving or he was just sitting, right? He was just accompanying. Whether he was wearing helmet or not, what was the activity? So to describe the mechanism of injury, you'll have to give all the codes which are given in chapter V00 to Y99. We will be seeing those codes. Okay, I'll show you what all kind of codes are there. But whenever you are coding for the injury, you have to give these codes. Say for example, if a person comes with a laceration of the arm, so you'll have to ask that person where he fall, where he slipped, where he tripped, where he was, what happened, how the situation happened. And for that, for all these situations, you'll have to give the codes, right? Whether he fall, whether he fall in the bathroom, he had a fall in bathroom, or he had a fall outside the home, whether he was on the road or in the garden, if he was playing soccer, which kind of soccer he was, which kind of ball it was, all that you have to give in the external causes of injury. All right. Now, if multiple injuries occur in the same body region, multiple injuries in the same body region, you can see here, code the highest one, which is more significant, more severe, that has to be taken. Code more severe or code more significant, more needs more significant care. For example, here there are multiple injuries on the face and head. Don't code this laceration on the cheek. No need. You have to code the severe one in the same anatomical region if it is there, or in the same body region. If it is in the multiple body region of the different sites, then you code as per the severity. You code as per the severity. Whichever is more severe, like we have seen here. If it is in the different anatomical site, code whichever is the severe. For example, if there is laceration and contusion on different body parts, laceration on the arm and contusion on the knee, first code laceration because that is more severe. Then code knee, that is contusion on knee. All right. But if there are multiple injuries on the same anatomical site, code which is more severe. Code which is more severe. For example, superficial injuries like abrasion, contusion, they are not coded. They are not coded when more severe injury is present in the same site. More severe injury is present in the same site. Do not code that. Now in this picture, you can see there are multiple injuries here, but the site of injuries are different. So in that condition, code first the most severe one, followed by all these. These also you will have to code. The abrasions, the burns, all that you have to code. But more severe is one that you have to code first. All right. So this is the sequencing of injuries. Superficial injuries of same site do not code. Right. So this is coding of injuries. Now we can see the codes for injuries. We have seen that, right? I'll just show you the code external causes. The external causes code which are given in this. See, V and from V till Y, all these are external causes code. Driver injured in collision with another specified, other specified in traffic accident. Non-traffic accident, car passenger injured in collision. Collision with what? Fixed stationary or moving object, non-moving object. He was passenger, he was driver, all these situations are there. It was a pickup truck, whether it was car, all right? So you have to take all these codes for describing the complete picture. Bus occupant injured in collision, right? I'm showing you just few of it, okay? Drowning. Drowning and submersion in sailboat, accident of sailboat. Drowning and submersion, accidents, drowning, accidents in the bicycle, accidents on the bike, accidents in the garden, pedestrian action, accidents. All these codes are given, right? So you have to give the complete picture, and for that you have to use all these codes, right? You can see here the code beaten by dog, contact with dog. This is for W codes. Beaten by rat. Crushed by alligator. There is one code for that. Crushed by alligator. Accident and malfunctionings of the machine gun. Military actions. You have code for military action. You have code for a hurricane. If there is injury due to hurricane, injury due to natural disasters. So all these kind of codes are given from V till Y. All right. War operations. You are getting injured in the war operations, right? All such codes are given. So you have to use external injury, the causes of external injury. Whenever you are coding injury, you will have to give these codes. External causes of morbidity. This is important. This is not a mandate by payer. Who is the payer? Who is the payer? Who is the payer? This is not a mandate by payer. Who is the payer? Okay. We have discussed these terms, provider, payer. Anyone who pays for the healthcare facility, he may be patient himself or maybe the insurance agencies, right? So that is not the mandatory requirement by the insurance agency or the payer, but it is a government requirement, all right? The government requires, so the federal government requires this, that external causes of injury should be given when you are coding for the injuries. All right, let us see about the coding of the burns. We have learned about the rule of 9. Remember, we have studied the rule of 9, pressure ulcers and rule of 9. So now when you are coding about the burns, we have to use multiple code. First code we have to use about the degree of burn, whether it is first degree, whether it is second degree, or whether it is third degree. Again, the same guideline comes here, whichever is the highest degree which should be coded first. If there are first and second degree burn, code first the second degree burns. If there are third and second degree burn, code first the third degree burns. All right, whichever is the highest severity, that should be coded first. All right, now these burns, the code for the burns are given as per the anatomical site again, and the degree of burn and anatomical site. First degree burn of arm, trunk, lung, and abdomen. Second degree burn of arm, trunk, abdomen, right? That way. So these are arranged according to the anatomical site. So first code for the burn will be the code of depth, whether it is first degree, second degree, and the anatomical site. And second will be by the extent, how much body surface area is involved. How much body surface area is involved is the code for burns, that you will see different types of burns, right? From T20 to T25 are the code given for the degree of burn. First degree, second degree, you can see here. burn of first degree of different anatomical sites. Okay. Then you can see here the burn of second degree of unspecified site, right? And after that is the code for corrosion. What is the difference between corrosion and burn? What is the difference between corrosion and burn? Yes. Corrosion is chemical burn or burn by chemicals like acids, some alkalis, some sodas that causes burn to the skin. So corrosion is by certain chemicals and burn is usually by radiation and heat or fire, right? Burn by radiation, heat or fire. So that is taken as burn. So you can see here burn of different degrees, burn and corrosion, first degree, second degree, third degree, as per the anatomical site. This is mentioned here. And after that, the code from T31 category are given for the extent of burn. The extent of burn and corrosion. Now we can see here burn involving 90% of the total body surface area. Out of that, how much area is of a third degree burn? Say for example, if a person has 25% of the second degree burn and 8% of third degree burn. How much is the total surface area now? 25 second degree and 8 third degree. How much is? We need to take all the code for the depth also and the surface also. If the depth of the burn is not given, take only the extent code. Okay, but if it is given, you have to take all the codes. If it is mentioned in the chart, patient chart, then you have to take all the codes. So just tell me the answer. Second degree burn of 25% of the body area and 8% of the third degree burn. How much is the total surface area now? How much is the total surface area? 25 plus 8. How much is total surface area? 25%. Yes, 25% plus 8%. So that is 33%. Correct. 33% is the total body surface area. And out of that, how much is the third degree burn now? How much is the third degree burn? I have told you how much is the third degree? 8. Right. So let us see what will be our code now. All right. Let us understand what will be our code. You tell me which code you can take. You know the total body surface area and you know the third degree burn. Total surface area is 33%. Total body surface area is 33%. And third degree burn are 8%. Yes. What code you will take here now? T31.30. Perfect. T31.30 will be the code that you will be taking. Right. All right. T31.30. That is the code that you will be taking for describing this situation. Got this now? Now say for example, if there is first degree burn of 10%, second degree burn of 17%, you keep calculating, okay? And third degree burn of 11%. 10, 17, 11. How much is the total? 10, 17, 11. How much is the total? 38. Correct. 38 is total. Out of that, 11 is third degree. Now, which will be the code? T31.31, right? So did you get the point? Yes. All right. This is how you have to use the extent of burn and the degree of burn. The degree of burn, here all the codes are given directly. In the degree of burn, you have to give the seventh character. Seventh character has to be given in the degree of burn. All right, so this is the coding of burns. We have seen the coding of injury, we have seen the coding of burns, we have seen the coding of fractures, right? Sequencing, you have to always take the highest degree first. For example, if there is second degree burn on arm and third degree burn on leg, you have to take first code as the third degree burn, that is the leg, code for leg. All right. All right. So let us come to the last chapter of ICD. Last chapter of ICD are Z codes. Now, what other name for the Z code is? We have discussed this. The other name for the Z code is social determinant of health. What is the other name of Z code? They are also called as social determinants of health. Why they are called as social determinants of health? Because they give you the reason for visit of the patient. They give you all the socio-economic background of the patient, and they give you all the environmental factors impacting the patient care. For example, there are codes like Z59 where housing, inadequate, poor sanitation, then children staying with step parents, parents having conflict in with the in-laws. These kinds of codes are given in Z category code, and that the reason, that's why they are called as the social determinants of health. Personal history of conditions, special conditions. All right, allergy to different substances. You can see here Z59 is the code for app. Right, I'll give you inadequate housing, patients staying with blood type, encounter for mental health checkup, encounter for other checkup. All right, person encountering health services for specific procedures which are not carried out. You can see the code for unemployment, code for change of job, code for threat of job loss, stressful work situation, uncongenial work, discord with boss and workmates. All right, discord with boss and workmate, sexual harassment on job, military employment, occupational exposure to risk factors, right? Then we can see failed school examination, the code for failed school examination, schooling unavailable, illiteracy, education and literacy problem with the physical environment, inadequate drinking water, homelessness, sheltered homelessness, unsheltered homelessness, okay, material hardship, unable to obtain child care. All right, problems related to the social environment like adjustment to life cycle transition, living alone. So all these are the social determinants of health. Extreme poverty, right? You can see here there will be codes about see upbringing away from parents, inadequate parental support, financial insecurity, institution upbringing, right? Then absence of family members, psychological abuse, right? History of abuse, neglect, post labor, adopted child, conflict between the child. Even there are code for conflict between the neighbors, conflict with the neighbor, right? Or conflict with in-laws. And the code for body mass index, the code for encounters and all these things. And just one more code you have to remember is do not resuscitate status. What do you mean by do not resuscitate status? What do you mean by do not resuscitate status? Can anyone tell me? What do you mean by this? Do not resuscitate. What do you mean by resuscitation? What do you mean by resuscitation? What do you mean by resuscitation? Yes. Any? What is resuscitation? Resuscitation means what? Yes, resuscitation means to bring the patient back to the life, to revive the patient, to make effort to save the patient's life. That is resuscitation. Now, this is DNR, that is do not resuscitate status. What does that mean? What does that mean? Have you heard many a times you have seen heard this scene from people around you that someone's relative was on ventilator and then the doctor came and then he said that if we remove the ventilator, the patient will die. Now what to do? Right? And then we decided that remove that ventilator, right? Remove that ventilator. And in that case, the doctor will write on the patient's record that do not resuscitate. Means do not try to save the life of the patient anymore. If it is there, if the patient survives, well and good. If it doesn't, can't help. So that is a do not resuscitate status. Z66 is a code for that. So you can see there are different types of social codes. Along with that, the reason for encounter, for what the patient has come, screening, okay, counseling, screening. You can see here even spiritual counseling. The patient come for the spiritual counseling, exercise counseling, right? Encounter for the screening, encounter for counseling related to the travels, encounter for employment checkup. These are also the codes given here. All the codes related to encounter and related to the different socioeconomic status are given in this. That is called as social determinant of health, SDOH, social determinant of health. We have done a lot of case studies. Okay, osteoporotic fracture of the spine. We will be taking the code from M category. Now, we have done the case study. So tell me the answers of these questions. Yes. For a patient with both fracture and a laceration on the same part of the body, what should be coded first? What should be coded first? On the same part of body, there is fracture and a laceration. What will be the first code? Yes, fracture. All right. Correct. Fracture will be the first code. That is a severe condition, right? Now, when coding the multiple, all right, when coding multiple injuries of the same body region, which injury has to be sequenced first? One which is more severe, right? One which is more severe, you have to code first, and after that, the remaining, right? When coding for the multiple burns, coding for the multiple burns, sure, not the largest area, highest degree burn, not largest area, the burn covering the largest area, no, extent of area not to be taken, extent of area not to be taken, surface area, A or B? It is always the degree of burn that has to be sequenced. Doesn't make a difference if there is 70% burn of total body surface and out of that only 1 is or 2% or 3% is third degree burn. Code the third degree burn. All right, doesn't matter how much is the extent of area, how much is the area. It is always the degree of burn that you have to code. Highest degree of burn that you have to code. All right, so the right answer is A. Don't get confused, okay? It is to be always the degree, not the extent of area. All right. What is the current sequence when both open and closed fractures of the same bone are documented? Open fracture. Only core open fracture. Okay. Core open fracture. Right. Core open fracture first. That is the more severe condition that is needed. All right. When coding for a traumatic amputation, amputation means where the limb is completely removed or cut from the body. Yes. What detail you have to write? Whether you have to write the degree of injury, you have to write external cause, or whether you have to write the complete or partial, or do you think everything must be included in the? Yes. In all the injuries, wherever possible, write the degree, also write the cause of injury, and also whether it is partial or complete. Right. Very good. Yeah, to see. Now, what is the primary reason for using external cause code? Why we do that? Why to write external cause? Yes. Why we have to write the external causes? Why we need? Is it sequencing of the injuries, documentation of the chronic condition, identify the mechanism? What is it? To know the complication. Mechanism of injury. What is the cause of injury? How the injury occurred? What exactly happened? No need for the severity. Severity will be given. Sequencing of severities will be by the documentation by provided by the physician or the provider. He will give you the severity. External cause has to be there for understanding mechanism of injury. Right? We have seen the external causes. What all causes are there? How injury occurred? Whether the patient was riding or he was driving or he was a passenger, whether it was a non-traffic accident, whether it was a traffic accident, whether it was in park. So what was the mechanism of injury? That is why we are coding the external causes. Mechanism of injury, place of injury, where injury occurred, how injury occurred. So we need to understand the mechanism, and for that reason we are coding external causes. Is everyone clear about this? Right? All right. Z codes are typically used for SDOHB, SDOHB, okay. SDOH. Only for that? Only for SDOH? They are called as SDOH, no doubt, but they are used for all of that. We have seen preventive health checkups, all of the above, right? Preventive health checkup, we have seen screening. Patient comes for the screening. Patient comes for screening of employment, counseling, right? Follow-up care, treatment after surgery, after care of the surgery, Z85, neoplasm, removal of neoplasm, after care of the neoplasm, Z45, right? We have seen that. So all of the above, though they are primarily called as SDOH, that is social determinants, but they are used for all of them, all of this. Which Z code is used for the patient who is on the long-term use of insulin? Yes, long-term use of insulin we have studied yesterday. Yeah, right. Few people are writing yes. Those who have written yes, they are right. I can see only one answering. Long-term use of insulin we have discussed yesterday. Yes. Z79.4, that is for long-term use of insulin. Right. Name any one social determinant of health. We have seen. Name the social determinants that we have seen. Anyone you remember? Okay. Tell me these questions. Answer these questions. Homelessness, depression, step parents. Okay. Housing instability, right? Okay, very good. Yes. Unemployment. No. Chemotherapy. Okay. I didn't find code for love, Karthik. Where did you find? Threat of job. Okay. Depression, being alone, homelessness. All right. All right. Name of the social determinants of it. All right. Then extreme poverty, failed school examination. Correct. Very good. Very nice. All right. What is the code Z51.11 says? It is for chemotherapy, right? Yeah, chemotherapy, encounter for chemotherapy. Very good. Correct. Z51.10 is about? Sorry, Z51.0 is about? Encounter for? Zero, I'm asking now. Z51.0, radiation. Chemotherapy, radiation therapy, right? Okay. Can Z codes be listed as a primary diagnosis code? Answer this. Yes or no? Can they be the primary diagnosis code? No, yes, no. If those who are writing yes, just give me one situation where you can write it as a primary diagnosis code or the first listed diagnosis. Give me any one situation, those who have written yes, give me one situation that comes to your mind where Z code is the primary code. Yes, those who have written yes, tell me one example where Z code can be a primary code. The moment I ask the question, example, people are changing their answer to no. From yes they to change to no. Yes or no? Can you code Z code as the primary code? Those who have said yes, please write one example at least. Tell me one example where you can write. Cancer. Cancer, what kind of cancer, Muskan? Chemotherapy. The answer is itself here. Encounter for chemotherapy. Encounter for screening. Encounter for antenatal checkup. Encounter for antenatal checkup. We have seen that. They are first listed diagnosis. Okay, they can be used as a first listed diagnosis. All right. Can X and Y codes be used as first listed diagnosis? Plastic and constructive therapy. Okay. For fourth question, tell me. Can X and Y codes be used as the first listed diagnosis? Yes or no? Can they be used as first listed diagnosis? Yes. Yes. Which are X and Y codes? What do they tell us about? What does it tell us about? Morbidity. About morbidity, you are the code. Yeah, external causes of morbidity, right? They tell us about the external causes of morbidity, that is cause. So can we take them as the first listed diagnosis? No? Yes? Yes? No? Can we take them as a first listed diagnosis? No, we cannot take them as the first listed diagnosis. We cannot. Because they are the causes. We just understand the mechanism. They are not diagnosis. They are not at all diagnosis code. They are just the code to identify the cause. Okay, so they are not diagnosis code. They are just additional codes to identify the additional circumstances, to tell us about more about the actual situation of the patient. So you cannot use X, Y, V, all these codes, V, W, X, Y, these codes cannot be used as the code for primary diagnosis. All right. Do not take this as primary diagnosis. Never. They are all additional codes. Right. So I'll just show you some of the codes from Y category. All right. I hope you are in a position to see the ICT book. Yes. All right. See, the code in the X category, they are all the code like natural disasters and activity, contact with hot drinks, contact with hot food, right? Fat and cooking oil, contact with other hot fluids, inhalation of the gases. All these codes are given exposure to natural radiation, volcanic eruptions, earthquake, volcanic eruptions. So these are all the code in X category. In Y category, you can see all these codes are there. Here you will find the code for abuse, right? Who has done the abuse? Who is the person who is doing this abuse, right? They are called perpetrator. Okay, who is doing the assault? So these codes you will find in Y category, and also the code for the activities, different activities that you will find in Y category. All right, legal interventions and all those. So these are all the external causes. Some legal interventions and all these things will come in that. Never quote them as a primary diagnosis, right? Never ever quote them as a primary diagnosis. All right. So those who have been asking me about the book and all those things, it will be uploaded soon. Okay, it will be uploaded soon in the LMS. All the PDF, those who are asking about the PDF and all this material that we have that has been shared through all these 7 days, last 7 days, that will be uploaded soon and you will find it. Okay. So don't worry about where can I find the PDF, where can I find the book and all those things. Right now, just go through the recordings, access the recordings. I think the recordings you can see on the YouTube also. You can access through the LMS also. Go through that. By the time books, that is ICD and CPT, will be uploaded soon in the LMS. All right. Anyone has any other question pertaining to anything that we have covered today? Right. So we covered complications related to pregnancy, sequencing of those codes, neoplasm, what is the terminology, how to assign the code, how to locate the code, how to sequence the code, what is current malignancy, history of malignancies, what is fracture, pathological fracture, traumatic fracture, how to code them, how to sequence them, different types of injuries, the burn, the extent of burn, right? And the code for Z codes. So we have covered that. Anyone has any doubt pertaining to what we have covered till that related to the material, the study material, it will be uploaded. So just have some patience. You will find all the PDFs and everything in the LMS, right? All right. So if there is no question on your part, then you can leave the session. You can just mark your attendance. Thank you, everyone. Thank you so much. Mark your attendance.
Thank you, ma'am. If you're done, means I'll take it up.
Yeah. Thank you
Thank
so much. We'll meet tomorrow, right? Thanks.
Yeah. Thank you.
Good night.
Yeah, good night. So, students, I hope you are done with your attendance. If not, I'm sharing again. So please mark it. I hope there is no more questions. Even ma'am also asked it. So yeah, thank you. Thank you for joining, and we'll meet on tomorrow. Yeah. Up to then, take care. Bye.